Hello everyone, I am Mohammed Aziz Rahman, Associate Professor of Public Health at Federation University Australia. Today I'd like to share with you a study that we conducted recently in Australia to examine factors associated with psychological distress, fear, and coping strategies during the COVID-19 pandemic. On behalf of all the investigators, I'm going to share a brief overview of this study. COVID-19 disrupted lives of people, which has increased distress due to rapid spread of virus, risk of deaths, fear of spreading infection to family members, or fear of own personal infection. In order to limit the spread of COVID-19, the Australian government introduced physical distancing rules, including restrictions on social gatherings, strict lockdowns, and border closures, with a pause on all social, cultural, and sporting activities. And such disruptions and feelings of uncertainty definitely have increased distress among the community members. In addition, isolation, quarantine, unemployment, concern of getting unemployed, all of them are putting stress among the community members. Healthcare providers are working under extreme stress. On the other hand, patients' healthcare seeking behavior has also been impacted due to this COVID-19. Now, what is the gap in evidence? Factors associated with psychological distress and fear due to the COVID-19 pandemic in Australia was limited. Therefore, the objectives of our study were to assess the extent of psychological distress, fear, and coping, and to identify the factors associated with psychological distress, fear, and coping among residents in Australia during the COVID-19 pandemic. It was a cross-sectional online survey. We developed an online survey link and distributed it to different social media and online platforms, which included community settings, along with general practice settings and allied healthcare settings. Anyone who was 18 years and above and who were capable to respond to online questionnaire were eligible to participate in this study. A structured survey questionnaire was used for our study that included three validated tools. To measure psychological distress, we use Kessler's psychological distress scale, that's K10. To measure the level of fear, we use fear of COVID-19 scale. And to measure coping, we use brief resilient coping scale. A total of 587 people participated in our study. 88% of them were from Victoria. Mean age was 41 years and 62% of our study participants were females. We found 1 in 3 study participants in our study reported high to very high level of psychological distress. Similarly, 32% of the participants reported high level of fear of COVID-19. Almost all of our participants reported low resilience in terms of coping. After adjustment of all the potential confounding factors, what we have found in our study that females had higher psychological distress compared to males. People who had pre-existing mental health conditions had higher psychological distress. People who increased their smoking in the last 4 weeks and who increased their alcohol drinking in the last 4 weeks had higher psychological distress in our study. Similarly, when we adjusted the potential confounding factors in terms of level of fear, we found females had higher levels of fear and people having higher psychological distress had also higher levels of fear. Interestingly, people who were born in Australia had lower levels of fear compared to the people who were not born in Australia. When we measured the coping, the people who visited healthcare providers in person had medium to high resilient coping compared to the people who did not visit the healthcare providers. Our study identified individuals who were at high risk of distress and fear during the COVID-19 pandemic situation in Australia. People with higher psychological distress increased their use of smoking and alcohol during the pandemic period. And that clearly warrants we need to target behavioral interventions for this vulnerable group of population. We also need to incorporate information on our available support services to quit smoking and reduce alcohol use in the health awareness campaigns. People with pre-existing mental health conditions were also more likely to experience higher psychological distress, and that could worsen their overall well-being. Probably an automated alert from the primary healthcare providers to this group of people for a follow-up visit would be invaluable in managing their distress. We also found that females were more vulnerable to psychological distress and fear. They really need to prioritize their well-being besides managing their family responsibilities. In our study, we found that residents not born in Australia had higher levels of fear. We need to have further investigations to examine the cultural context regarding this. If you have any question regarding this study, please feel free to drop me an email. Otherwise, enjoy reading. Thank you.